You have chronic knee pain that is preventing you from doing something that you love. And it could be something just as simple as walking, or it could be running, or it could be trying to go upstairs. Because anytime you go upstairs, it really loads the knee and it can cause a lot of problems and it increases pain. Or maybe you can't do an exercise you want to do, or even worse, you can't do a hobby you want to do. Here at our clinic, we have come up with a knee treatment protocol that is a solution for this problem. And what we're going to do is we're going to take it from more of a comprehensive plan. This is not just taking one modality, but it's taking many modalities that we have put together that's going to help reduce your pain. When you come to the clinic, we're going to start, but it's going to take many steps. So the very first thing that we're going to do is we're going to have you warm up. And it could be on the treadmill, but most likely if you have knee pain, we're going to use our exercise bike. Because what we're going to do is warm up the tissues around there to start, get everything ready to be worked. The second thing that we're going to do is we're going to add some form of soft tissue therapy. Right now, Dr. Brolin is doing grafting technique on me, and what this is going to do is help break up any kind of adhesion or scar tissue. It'll help loosen up the muscles so that they actually allow the knee to track in the correct position. It might not be just grafting technique. We could also use like active release, pin and stretch, factor therapy. We can use taping, we can use cupping, we can use dry needles. Any of those can help affect the soft tissue and can help move the knee in the right direction as far as allowing the muscles to do what they're supposed to do. The next process will be something that we call acoustic wave therapy. It's also known, you'll see a search for on the internet, it's called shockwave therapy. What this particular machine does, it has actually an air compressor and then a gun, and what it does is it emits a sound wave. And what those sound waves can do, they can penetrate deep into the soft tissue, they can go all the way into the knee joint. And what it'll do is it'll disrupt the tissue, which can actually promote the healing. There's actually was a study done with rabbits that showed that it increased stem cell production. If you don't know what stem cells are, they're the actual building blocks of the body, so they can really help with promoting healing deep in the tissue. So that knee is going to really jumpstart the healing process with this shockwave, or we call it acoustic wave therapy. Sounds kind of like a jackhammer. And right there you see is it's penetrating down into the tissue, and it's allowing everything to be broken up and start the healing process. Then the next thing that we're going to do as chiropractors, we're actually going to manipulate the knee. And what's important about adjusting the knee is it's going to make sure that it is in the right place. It's going to allow for a distraction to open up the joint space, and then it's going to put everything where it's supposed to be. And then the last thing that we're going to do is actually what's called our knee on track. This is knee traction. Some people call it decompression. What's really helpful with this is that we put you on a machine, it kind of holds your thigh still, grabs a hold of your leg, and it actually applies force in between. It varies on how much you weigh, and will actually distract the knee. What it's going to do is it's going to open up in between here. It's going to create that space, open it up. And even with people that have been told, oh, we have bone on bone, we have treated so many people that have been told they have bone on bone that it's actually not quite that bad. And when we get in here and we open it up and try to get that space, open up and make the knee have more room to articulate, then it decreases your pain. We'll do this over a series of sessions. It's not just a one and done fix. It actually takes about 2 months to be able to resolve this problem, but we can absolutely correct your knee pain, get you back doing what you love. Call us today if it sounds like something you're interested in.